पहली क्लास में बड़ा मन बना के गए थे पर गुरुजी आए ही नहीं, ओबीजी की क्लास थी। गुड मॉर्निंग एंड वेलकम बैक टू मुसाफिर मेडिकल। बरसात जिस दिन हो उस दिन वैसे ही सुबह उठना मुश्किल होता है और भाई एक बार को उठ भी जाओ, तैयार होके पहुंच जाओ क्लास, भले ही 10 मिनट लेट, पर टीचर ना है ना, दुख होता है अंदर से। अब क्या कर सकते हैं, नाश्ता करके अस्पताल की ओर बढ़ते हैं। सी सेक्शन था ट्विंस प्रेगनेंसी का, पहली बार ट्विंस देखे और बड़ा भाई छोटे भाई से बस 30 सेकंड बड़ा था। अब क्लास चलते हैं। नींद तेज़ आ रही है जैसे कि आपको दिख ही गया होगा, और बस एक बढ़िया सी कॉफ़ी पी के थोड़ा आराम करने का मन है। संवाददाताओं से पता लगा है कि उडुपी मणिपाल में रेड अलर्ट लगा दिया गया है, अगले 5 दिनों तक लगातार बारिश होगी। तो बचते बचाते सही सलामत बस कमरे पे पहुंच जाएं, बहुत है। एक क्लास मिस हो गई, अब बारिश थोड़ी कम हुई है तो ऑर्थो की क्लास करने जाते हैं। यहाँ से जाते जाते पैर गीले हो जाते हैं और वहाँ पर भाई क्लास में एसी में बैठो तो पैर वैसे ही ठंडे हो जाते हैं। ठीक है भाई, बारिश पसंद है पर इतनी भी नहीं यार।
Ligation of the coronaries. Yeah, you're going to laugh about it now, but when you're in the exam hall and you see that your 10 marker is something out of the blue, your mind is going to do that. So, in any question, the first thing that you're going to talk about is the anatomy. Anatomy. The femoral head forms 2/3 of a sphere and is covered by hyaline cartilage. It is the ball to the ball and socket joint of the hip joint, with the socket being the acetabulum. It's covered with hyaline cartilage. It has a little dip there for attachment of the ligamentum teres. Osteoporosis, due to poor muscle tone, the bone is so weak that it cannot take physiological loads. So sometimes it is a fall which causes the fracture. Other times when the person is simply walking, the fracture can result in the patient falling. In 99% of the cases, X-rays are enough. Plain radiographs of the femoral neck are sufficient. You'll be able to detect a femoral neck fracture. So how do we treat these people? Initially, we follow the ATLS guidelines, Advanced Trauma Life Support, airway, breathing, circulation. Every person, before you get excited or carried away by an X-ray, you have to save their lives. So whenever you approach someone, airway, breathing, circulation, make sure all of those are unimpeded. There's a pulse, they're conscious, they're talking to you, they're not losing blood anywhere, there's no head injury, there's no tension pneumothorax. Make sure that is fine. Splint the injured extremity. When you see the limb that is in external rotation, you can splint it. And one of the common ways we splint it in our wards is with skin traction. So we put traction with the help of crepe bandages and splints. So what does this traction do? It keeps the broken bone ends apart and thereby reduces the pain. So what's the treatment of femoral neck fractures? So the femoral neck which has been fixed with multiple cancellous screws, and here's a dynamic hip screws fixing a base cervical, femoral neck fracture.
Logically, what will happen after this? It won't dilate, agreed. But something is coming out from behind the pupil, behind the iris. Aqueous humor is coming. So aqueous humor is being produced here. It is going to go on accumulating in the back. It has no place to go. The door is closed. The pupil is blocked. It cannot go in front anymore. So it will start pushing the iris in the front. It will balloon out in the front. This is like the, you see Sinbad the sailor, like that, in the sea. Okay, boat in the sea. You see?